Chlamydia infection is a common sexually transmitted disease caused by the bacterium Chlamydia trachomatis. It was first described in the early 1900s, and today it is the most reported bacterial STI worldwide, making it a major public health concern because many people have no symptoms yet can still spread the infection. The illness is caused by C. trachomatis, especially serovars D to K, genital, L1 to L3, lymphogranuloma venereum, and a to C, eye disease. It spreads through vaginal, anal, or oral sex, from an infected mother to her baby during birth, and by direct eye contact with contaminated secretions. Young adults, people with multiple partners, and those who also have other STIs are at highest risk. C. trachomatis enters human cells and lives inside a special bubble called an inclusion, where it replicates. The immune system reacts, causing inflammation. Over time, the inflammation can scar tissue in the fallopian tubes, urethra, or rectum, leading to problems such as infertility or chronic pain. About 130 million new cases occur each year worldwide. In most countries, teenagers and people aged 15 to 24 account for the largest share. Women usually have higher reported rates because they are screened more often. Screening programs have lowered rates in some high-income nations, but numbers are still rising in many low- and middle-income areas. Up to 70% of infections show no signs. When symptoms appear, they may include painful urination, abnormal discharge, or bleeding between periods in women, urethritis, cervicitis, PID. Outside the genital area, chlamydia can cause red eyes, conjunctivitis, swollen groin lymph nodes, LGV, or joint pain, reactive arthritis. Doctors suspect chlamydia when a person has risk factors or symptoms and follows screening guidelines. For example, yearly testing for sexually active people under 25. The gold standard test is a nucleic acid amplification test, NAAT, performed on urine or a swab from the cervix, urethra, rectum, or throat. Samples must be placed in a transport medium and sent to a lab quickly. Culture and antigen tests are less common, while serology is used mainly for LGV. Infections are grouped by location and by bacterial strain. Genital infections serovars D to K affects the urethra, cervix, rectum, or throat. LGV L1 to L3 causes deeper tissue disease and swollen lymph nodes. Eye infection A to C leads to trachoma. Clinically, infections can be acute first few weeks or become chronic if untreated, resulting in scarring. First-line treatment is a single 1-gram dose of azithromycin or 7 days of doxycycline, 100 milligrams twice daily. Pregnant women receive azithromycin because doxycycline is unsafe. If complications like PID or epididymitis develop, extended antibiotic courses and possible surgery are needed. All recent sexual partners should be treated, and patients are asked to tell them partner notification. Using condoms every time reduces transmission by about 50 to 60%. Regular screening, once a year for sexually active people under 25 and more often for high-risk groups, catches infections early. No vaccine exists yet, but research is ongoing. Currently, there is no chemoprophylaxis like a daily pill for chlamydia. When treated promptly, cure rates exceed 95% and long-term damage can be avoided. Untreated infections may lead to infertility, ectopic pregnancy, chronic pelvic pain, or persistent joint problems. Reinfection is common, up to 20% within a year, if partners are not treated or safe sex practices are not followed. New rapid NAAT devices now give results in under an hour and can be used at clinics or pharmacies. Some regions report low-level resistance to macrolides, prompting research into new antibiotics such as solithromycin. Several vaccine candidates have entered phase 1 trials, showing promising immune responses. Mobile app reminders and at-home testing kits have increased screening uptake among young adults.